Als internationaal behandelcentrum kun je dus je eigen behandelmethodes ontwikkelen. VillaRamadas heeft dit ook gedaan. Hierdoor is het model Change and Grow ontstaan. Dit is een vrij nieuw model in de geestelijke gezondheid en verslavingszorg. Het model is ontstaan vanuit de behoeften van de cliënten en vanuit de expertise van het centrum. Het wordt voortdurend onderzocht en getest. Eduardo vertelt ons hier meer over.
The treatment emerged because in nowadays in the treatments we don't only help clients with problems of alcohol and drugs, but we help also clients with self-harm, with anorexia, with the depressions, with the gaming, codependent or depression. And so we are helping clients from 49 different countries, and therefore, which they have different types of religions, which they have different types of beliefs, and we need to develop a very simple program based on 5 principles that they could be adapted to any personal development. Because we don't focus in the substance of the client, but we focus on the building the self-esteem in the way that the client they can feel happy with himself inside of him. The 5 principles, it is the truth. We always need to tell the truth in the way that the client can accept that they have a disease. In the moment that they accept, they can work on the solutions. Also, it is super important to be grateful, because a person who are not grateful, usually or it is arrogant or stupid. I believe it is the two. And it is important to develop the self-love and love for the others. And the last principle, it is the responsibility. It is not because the parents have divorced, it is not because you have a bad childhood that you have become an addict, an alcoholic, a depressed. They have happened. The life, it is not fair, and it is responsible from now on to find solutions and look for the solutions of his life. The results that I see by using our model, it is that persons found a balance and they can have a normal life by applying the tools that they learn in the treatment on the normal life. When they have the difficult days, when there are some cravings or some triggers who can remember old behavior, they can remember what they have learned in the treatment and apply on the daily basis, and therefore reduce the level of anxiety and special have this freedom to choose. Because from now on, in the moment that they leave the treatment, they can have this freedom to choose. They don't need to act always in the old behavior.
Our programs are decided for our psychiatrist and also the clinical director. They decide the program, and then the psychologist implement it to each patient, and also they can change the program or adapt the program by getting in contact with a psychiatrist and decide it different in order to adjust it to the needs of the patient. The clinical team keep contact with a psychiatrist daily, and for instance, if there is any change on medication, we also ask him and everything is treated on right away. And we also have the option of doing family meetings, sometimes to clarify family doubts about the recovery of the patient, or also to update the family on the progress of the patient. But the clinical team needs to decide that when it's possible to do it. We work with many kinds of therapies. We work with cognitive behavioral therapy, mindfulness, creative therapy, psychoeducation therapy, and from all these therapies, we can focus here on 3. Mindfulness is an essential therapy we do here in our program because it allows the patients to feel more calm at the end of the day after processing a lot of feelings. It also allows them to calm down, to deal with feelings of anxiety, of boredom sometimes, and they can relax and sleep better at night. EMDR is a therapeutic technique that allows the patient to work on trauma, to reprocess some memories from traumas from the past, and this allows them to have a new vision and a new format in a brain way.
Dit is slechts een greep uit de therapiemogelijkheden die aangeboden kunnen worden. Gezien de diverse behandelingen is de verblijfsduur per cliënt verschillend. Het onderkomen is in deze periode ook enorm belangrijk. Josephine Swift neemt ons mee naar de 5 boutique-klinieken waar ze ons vertelt over de verblijfsmogelijkheden.
Our international residential program offers the clients facilities to stay in that are not institutionalized. We're not a hospital. What we're offering is a home from home so that they can feel comfortable to partake in their treatment during their entire treatment program. Privé program is for clients that have very little time and need to get back to their businesses. And so this is a program of about 21 days where the client will stay in an excellent hotel and the treatment program will come to them. The International Treatment Centre, we are licensed to treat individuals from the age of 14, and our oldest client to date has been 86, but really there's no upper age limit. We have treated individuals from 49 different countries, in many languages, of all types of religion. So a client in the Villa Privé program can expect all the facilities of the hotel, which includes the spa and the business facilities. So they can keep up to date with their own business at home while they're doing their treatment program. Also, and depending on the likes and dislikes of the client, we normally can expect them to do maybe yoga or have PT sessions, and all that can be arranged based on what they like and what they want to do. When we step outside the hotel and in their leisure time, what we've got are fantastic restaurants in the local area, all with very good Portuguese food. And then, if they are disposed to playing golf, we have 3 championship courses in the area, along with some of the best surfing beaches, I think, in Europe.
We zijn intussen enorm nieuwsgierig geworden naar de ervaringen van de cliënten. We hebben een aantal oud-cliënten bereid gevonden hun ervaringen met ons te delen.
Ik ben geholpen voor PTSD, trauma, jeugdtrauma, depressie die erbij kwam. Daar ben ik voor geholpen hier.
Ik had gewoon een ernstig probleem met maat houden en dan vooral alcohol. Dus dat was wel de insteek van mijn bezoek.
Ik ben hier gekomen voor mijn depressie en een stuk traumaverwerking en een klein beetje dwanggedrag.
Ja, waar ik het meest dankbaar voor ben en wat ik het fijnst heb ervaren is hoe persoonlijk ze zijn. Dat je geen nummertje bent, dat het echt om jou gaat. Ze doen ook de hele behandeling op jouw persoon en op jouw trauma of jouw depressie helemaal afstellen. En ze fine-tunen het ook nog terwijl je in het programma zit.
Ze hebben mij gewoon de spiegel voorgehouden. Daarmee heb ik gewoon naar mijn eigen persoonlijkheid en gedrag gekeken. En die is daarmee wel voor een groot deel anders geworden. Ik heb ook bewust gekozen voor een andere beroepskeuze. Ja, ik wilde gewoon wat terug doen, ook nu, voor de maatschappij. En dat had ik vroeger helemaal niet. Ik was alleen maar met mezelf bezig.
Voor mij was het ook de mix en dat ik uit mijn vertrouwde omgeving wilde. Dus niet in Nederland blijven, maar gewoon echt afgesloten van alles en iedereen. In combinatie met het programma wat er geboden werd en de persoonlijkheid van de therapeuten. En dan nog eens een keer, en dan spreek ik voor mezelf, het geluk dat ik ook toen die groep heb getroffen. Maar ja, als je zo diep in de put zit en als je dan zo'n waanzinnige ervaring kunt beleven, want zo is het uiteindelijk wel, zo kijk ik erop terug, ja, dan is het wel de combinatie, zeg maar, van alles geweest.
Deze cliënten hebben de behandelingen dus met succes afgerond. We vragen ons af of iedereen zo'n behandeling met succes kan afronden en wat de plannen zijn voor de toekomst. We hebben dit dan ook gevraagd aan Josephine Swift.
A client coming to an international treatment center in the international programs can expect a success rate between 84 and 87% on completion of the treatment program. And I can really put this down to the excellent team of therapists and the model that has been used over the last 20 years. Here at the International Centre, we're celebrating 20 years this year. And in those 20 years, we've seen the client change and evolve. Today's client is the smartest and most well-educated clients we've been treating. The families are more educated in addiction problems and psychological issues than they have ever been before. In response to that, our treatment model is evolving to meet the needs of the client and their families. Currently, our model, which is called Change and Grow, is being evaluated scientifically. It's an ongoing process. And we're trying to bring in the new techniques that are required for the next 5 to 10 years. And currently that is looking like virtual reality for the treatment of alcoholism and using app technology to allow patients to return to their normal everyday lives with something in their pocket that will help identify the triggers and relapse prevention.
Er is dus meer in Portugal dan zon, zee en strand. Hier kunnen er oplossingen gevonden worden. Oplossingen voor een nieuwe manier van leven en de vrijheid om een nieuwe levensfase tegemoet te gaan. Dat was het alweer voor deze uitzending. Bedankt voor het kijken en wil je meer weten? Kijk dan op onze website. Tot volgende week.